welcome to today's presentation. We're going to discuss research and epidemiology for May 2022. And the following is today's outline. So we have A1, define disease surveillance, then A2, notifiable diseases found in Zambia, which we're going to list, then B, the 5 principles of disease surveillance, then C, we're going to list the types of surveillance. Then D, we're going to list the data sources for surveillance systems. So let's begin with objective number 1, which is the definition of disease surveillance. So disease surveillance is the ongoing systematic collection, analysis, and interpretation of specific data for use in the planning, implementation, and evaluation of public practices. Then A2 lists the notifiable diseases in Zambia. So we have the following: number 1, cholera; number 2, malaria; number 3, shigellosis; number 4, anthrax; number 5, typhoid fever; then 6, we have meningitis; 7, tuberculosis; 8, yellow fever; 9, lower respiratory infection; then number 10, rabies. Let us now discuss the principles of disease surveillance, which is B. So the first principle is a good surveillance system requires a case definition, which includes clinical or microbial criteria. Then the second one is a systematic collection of data, which should be conducted in a systematic, regular, and uniform manner. The third one is analysis of data to produce statistics by time, place, and person. The third or fourth one is the case definition must be sensitive enough to detect cases and also specific enough to prevent too many false positives. The fifth one, which is our last principle, is several surveillance systems with differing levels of sensitivity and specificity may be used in combination to provide multifaceted information aspects such as burden and also high risk groups and laboratory confirmed characteristics such as antimicrobial susceptibility profile. Let us now move on to objective C, which is list the types of surveillance. So we have 1, passive surveillance; 2, active surveillance; then 3, sentinel surveillance; then the fourth one is syndromic surveillance. Let us now move on to the last one under today's discussion, which is D, list the data sources for surveillance systems. So we have 1, healthcare professionals; 2, hospital activity data; then the third one is laboratory data; then the fourth one is internet; then the last one is the mortality data. So this marks the end of today's discussion, and see you next time in the next presentation. Thank you so much for joining me. As always, have an amazing day.